Hi everybody, this is Dr. Craig Sanford, and this video is going to show you some common therapies and rehabilitation therapies that are employed in our clinic as well as many physical therapist clinics. The first thing I want to go over is an ice pack. We utilize ice on people that have an inflammatory condition. In other words, that would be when a person has strained their back recently. And the first thing you always do in a fresh strain of a back is you always put ice on to decrease the inflammation. So if, say, you're out mowing your lawn and you hurt your back, you always put ice first and not heat. Heat can actually make the condition worse. So we're going to employ ice anywhere between 15 to 20 minutes per hour several times a day. And that's anywhere between 24 and 72 hours. So that's ice. The next thing we're going to want to do is, as the condition goes through from acute to chronic stage, in chronic stage you're going to be feeling that injury becoming stiff and sore. Usually the patient will wake up saying that they're stiff and sore. So we're going to employ a heat pack, and in the same manner, 15 to 20 minutes several times a day. We usually employ that with some stretching as well to start lengthening the muscles, but we'll get to that in just a minute. But the heat pack actually brings blood into the area. What the blood does is it's going to relax the tissue, and it's also going to bring nutrients as the blood flows into the injured tissue. Another commonly employed therapy is electric stimulation. Electric stimulation puts an electrical current through the injured area or the muscles of the injured area. By putting a mild electrical current through the muscle, we're causing that muscle to contract. We employ this therapy for approximately 10 to 15 minutes per treatment. The muscle is contracting off and on or constantly through that treatment time. At the end of the treatment time, those contracted muscles will relax. Not only does it relax the muscle, but it's also bringing in blood and pushing out the lymphatic system. The lymphatic system is the part of the muscle that collects the garbage, so we want that out of there. Okay, another therapy that we also employ is we utilize ultrasonic therapy or ultrasound. This is utilized for deep heating the tissues. What do I mean by that? Well, tissues that are deeper into the body. Muscles actually have a very good vascular or blood supply, as well as bone has good vascular supply because bone has pores or it's porous. But when we're talking about ligament damage and tendon damage, ligaments and tendons have very, very poor blood supply. So the ultrasound creates an ultrasonic wave which bounces off the tendons and ligaments, which are deeper in the body, and heats them up, allowing them to have more blood supply and creating a softness to that area. This is a wonderful therapy to be utilized after many different injuries. So we've just covered some of the basic physical therapy modalities. Now we want to talk a little bit about rehabilitation. So there are basically three parts to rehabilitation. One would be stretching, one would be strengthening, and we can also employ what we call gait exercises. So we utilize three different types of stretching exercises when we're working with a patient. One would be a passive stretching exercise, one would be an active exercise, and the other one would be passive and active utilized together. So passive is when the doctor or the therapist is working with the patient and takes the joint, and we'll say a knee joint in this case, through range of motion without the patient helping at all. The patient is to relax as much as possible as the therapist or doctor takes that joint through range of motion. And the idea is to get that joint to loosen up. This type of stretching is utilized a lot of time after post-surgical, where the patient is not supposed to be contracting the muscles too much. The next type of stretching is what we call active. This is where the patient is actually doing the stretching, and the doctor or the therapist is guiding that patient through the stretch to make sure that they're utilizing the correct technique in order to stretch that muscle correctly. And the third technique would be passive active. In other words, the patient is performing that stretch with the extra added addition of the therapist or the doctor adding weight to that stretch in order to cause the stretch to increase. So that's stretching. The next thing we want to talk about would be strengthening. Strengthening needs to be employed around a joint to make sure that that joint is secured. You'll hear a lot of people talk about core exercises. Well, a core exercise is nothing but strengthening the muscles around the lower back. So it would be the abdominal muscles, the side muscles, and the back muscle. This core muscle creates more stability in that midsection. So, of course, we can use an exercise where we ask the patient to just contract the muscle. That's going to help strengthen. We also can use simple weights. We can use machinery, and we can also use band as resistance in order to create strength within that muscle. Again, as we create strength in the muscle, we can also create balance with that in that joint area in order to rehabilitate that individual's problem. The last therapy or rehabilitation therapy that I'd like to talk about is gait therapy. Gait therapy is something like walking. In this case, inside of a facility like a gym where our clinic is located, we're going to utilize either a exercise bicycle or a treadmill. By doing so, we're increasing the patient's circulation, which creates overall healing in the body, but we're also creating balance within that body from side to side, and we're also working the different joints in that body, creating stability in a real-life balance. Well, that's all for this video today. I hope that you found it informative as well as instructive. If you have any questions or you'd like to make an appointment, please call the number that you see on the screen. And thank you again for watching.